so they won't sit down there. Phobia. Or someone watch the empty space. They feel, wow, nothing helpful or dangerous. Because the big squares, they feel fear. Or someone enter the small room, they feel chunky. They feel not comfortable. Even the elevator don't feel safe. Every time go to the airplane, they feel a lot of anxiety comes. But I won't tell people, everybody go to on board. Why you feel that way? But he feel, oh my gosh, you go too far, I worry. Don't jobs or something happen, the anxiety. So when they get out, maybe better, but I won't tell. That kind of thing, repeat. No, that's the very common anxiety. So that's a phobia based also. The phobia, we know the Shen issue, we have to stabilize the Shen, also we have to strengthen the Shen. Also have to centralize the Shen, ground the Shen, grounding the Shen. So anyway, everything we can harmonize the Shen. We can call harmonize the Shen. So make the Shen more stable, more centered, more harmonized. So when something's ready, when your Shen is prepared, you're strong enough. You don't have so much the anxiety, panicky, even the phobia. Investment, understand. The Shen can be goes to different way. You go to general anxiety, they're different from panic. Someone always show the emotion, the panicky, also different from the phobia. The phobia has a phobia type, energy go there, they're different from the eating disorder. That's true. That's true. Even on the surface, the symptoms different. In the deep inside, the consciousness, the core part, still they have struggling, conflicting. But the manifestation can be anything. But deep inside, the struggling, anxiety feeling is the same. So that's why we want to stabilize that kind of Shen situation. So nobody generally say nobody have the situation without any no reason. They should have the reason. Obsessive compulsive disorder, we call the pattern the Shen irritability, also inflexibility, OCD. Because they don't do repeat this, they feel anxiety. Repeat it, they feel, oh, I'm so stupid. But still repeat again. So that's the OCD feeling. Sometimes even they understand, they still repeat the same way. So that's a bad energy cycle. So we call it Shen irritability, Shen inflexibility. So that's why I do the treatment. You have to try to break up the cycle. Let the patient get out from that kind of mistake zone. From there, change the pattern, moving. Because that's the inflexibility. You have to do the moving and regulate the lifestyle until they don't hold that pattern to think, to behave. Sometimes even very simple. Some of the kids stay in the home, do the bad thing, repeat the same pattern, or addicted to the TV games. You just put them on the outside door, the activity, they change it. Or go to the text messaging every night, several hours, right? But let them do something else instead. So when they break out this pattern, they change it. Or just go to bed on time. They don't have midnight the time to do something very bad. So they change the behavior. If they can initiate that kind of behavior in the beginning, everything on the track is easy to pushing and move. But just how to start, that's the key. So that's a related psychotherapy that, we call the communication, Shen interaction, everything, how to maintain the treatment relationship, that's the psychotherapy, the clinical type of technique. But also our Shen treatment, the technique. Maybe we'll have another class we can do. Also we call it Shen irritability in complexity type. With a depression disorder, you boost energy, boost the Shen. With a sleep disorder, regulated the sleep. With hypochondrial feeling, you have give some explanation. Also let them do some exercise. Let the body energy towards the outside. Don't put energy too much towards the inside and feel the body move there, move here, there pain, there pain. Even the headache, they feel vessels jumping, heart beating, they feel it. Why? Oversensitivity. Make a connection with the nature, can regulate the energy. Your body energy more weak, the Shen energy more weak. Your tolerance, the threat more lowered. The hard to tolerate the pain. That's why weak body, weak energy feel pain more. If the guy energy is enough, something enough, even some injury, they don't care. You see the construction worker, they bend the finger, right? The finger totally smashed by the hammer or something, but tied up, I have to finish the job, later go to the hospital. You for general people, you cannot do that. They have nail penetrated, they still, pulls out, or tied up, or maybe go see the doctor, we'll have finished it, that's fine, even no bad things. They're strong, really. They don't see the doctor bleeding, scratches right away. But for general people, you are very sensitive. Tiny thing you feel pain. Slight migraine you feel headache. Insomnia make a headache. Cramping make upset. Our body is weak right now. That's why we have to let the people go back to the nature. Maintain the circulating, maintain the harmony power. So you can make your body more healthy. Pain disorder type also, we manage pain. Basically, we say qi stagnation, blood stagnation. Energy stagnation causing the pain. When the energy flow well, no pain. Body also have a harmony power, no pain. Cycle issue, directly related pain. You think about the pain, that's psycho issue or physical issue? I think that's just a psycho issue.